Good afternoon and welcome to Downing Street for today's coronavirus briefing. I'm joined by Professor Jonathan Van-Tam, the Deputy Chief Medical Officer, and Dr. Mary Ramsey, the Head of Immunisation at Public Health England. And I've got some fantastic news to bring you today on the success of the vaccination rollout and the protection that it's bringing right across the United Kingdom right now. Yesterday, we delivered 529,119 vaccinations, more than 500,000. And that means that today, exactly 100 days since Margaret Keenan got that first authorised jab in the whole world, we have now vaccinated over 25 million people across the United Kingdom. It's been such a national mission, one of the biggest logistical exercises since the war, and I've had the honour of playing my part, we've had the honour of playing our parts. It's been a huge team effort, and I've got absolutely no doubt it's the best project I've ever been involved in. And I want to say a huge thank you to everybody who lent in and has done so much to put this country in the position we're in, where we've been able to vaccinate almost half of the adult population, 25 million people. And I think that it's nothing that any of us who've been involved in it from the start will ever forget. But what really matters is why this is making a difference. And we have some very exciting information for you today about the real-world impact that the vaccination rollout is having. If we could have the first the slide, please. This slide shows over time the increase in the proportion of people who actually have COVID-19 antibodies. Those are the antibodies that are so crucial in our ability to fight the disease. This chart isn't measuring how many vaccines have been done. It's actually measuring the proportion of people who have the COVID-fighting antibodies swimming around in their bloodstream. This chart represents the fact that the vaccine is giving the country protection. And as you can see, it runs up to the start of March, and it shows around 90% of people aged around 70 and above at that point had these antibodies, and it has continued to expand further in the 2 weeks or so since then. The chart explains why deaths from COVID in this country are now thankfully falling so fast. They're down by over a third in the last week again. And the vaccine is saving thousands of lives right now here in the UK. And it can give us all hope. And Professor Van-Tam is going to say a little more about this and the safety details in a second. And all of this underlines how important it is that when you get the call, get the jab. I find this data really compelling. And to anybody who still has concerns or any doubt about getting the jab, we know that the vaccine is safe and helps make you safe. It gives you this protection. And Dr. Mary Ramsey is with us because she's going to set out details of a publication that Public Health England have just released with more evidence of the impact of the vaccine to show what this protection is like. And that shows that after a single dose of the vaccine, either vaccine, protection against COVID-19 is around 60%. That's protection against getting it. Protection against hospitalization is around 80%, and protection against death is around 85%. And one of the other interesting facts that is really important is that the vaccine offers protection to you, but it also offers protection to those around you. And the data show that if you live with someone who's been vaccinated, you have a 30% lower risk of catching COVID-19 yourself. This is the first data that directly measures the impact of the vaccine on reducing transmission, and it shows that the vaccines are saving lives. Both vaccines being rolled out in the UK are not just safe, but they make you safe. they're saving lives and protecting people. And because we're rolling out so fast, and because we've protected so many people so quickly, we're now able to extend the offer of a vaccination to yet more people. All people aged 50 and above are, from today, invited to come forward and get a jab. The NHS will contact you, and today we're sending over 2 million texts and letters and invitations to get vaccinated. Anyone aged 50 and over can now sign up on the nhs.uk website or call 119. We're on track to offer a first dose to everyone in priority groups 1 to 9 by the 15th of April. While we deliver on that commitment, we also want to ensure that this offer reaches everyone in groups 1 to 9. So, at the same time as opening up offers of vaccinations to all those who are 50 or above, we're going to do whatever it takes to reach all those in the most vulnerable groups who haven't come forward yet, before we move on to the next cohort, which is people in their 40s. So my message to our huge team of vaccinators is, let's keep getting the numbers through the doors, but it's absolutely critical that we reach out and we loop back and we invite in yet again all those who are in vulnerable groups who haven't yet been vaccinated. I want to get those percentages of the people in vulnerable groups, the percentages who've been vaccinated, I want to get them right up, reaching every last vulnerable person. And it is worth that extra effort. And we'll do that before we move on to people in their 40s. Now, I'm 42, and I'm as eager as anyone to get the jab. But before we forge ahead, I want us to be confident that we've done everything we can to protect those most in need of protection. And we will do all we can and do everything necessary to secure the supplies that are contractually committed to protecting people in this country. So we're moving in the right direction, thanks to everybody following the rules that are keeping us safe now, and thanks to everybody coming forward to get a jab that will keep us safe for the future. Now is not the time to waver. We're on the road to recovery. The vaccine is our way out. We are on track. So let's stick with it, follow the rules, and when you get the call, get the jab. I'm now going to ask Mary to set out more details of that excellent data on the effectiveness of the two vaccines.
Thank you. I'd just like to start by adding my thanks to Secretary of State, to the thousands of people who've been involved in making this programme a success, from the scientists who produce the vaccine, from the people who make sure the vaccine gets to the right places, those injecting people every day, and all the people behind the scenes who are doing all the planning and coordination. It's really been a great effort. And I've worked in immunisation for 30 years in the UK, and this is the largest and most fast delivered, but in the most speed I've ever been involved in. And it really is a great credit to the public health system in this country. Around a month ago, we published our first data showing the effectiveness of the vaccine. And today we've published an update on that. And the good news is that things are continuing to show that these vaccines are effective. We're showing good protection in the over 70s. We've compared individuals who test positive to individuals who test negative and shown that there is a 60% reduction in your chance of catching COVID if you are over 70 and have been vaccinated with both vaccines. And those effects are maintained for several weeks. They don't go away. They're still there, even after a single dose. And then you get additional protection from the second dose. On top of that, even if you do get COVID, having been vaccinated, our data shows that your risk of requiring hospital admission is reduced by a further 40%, based on whether you've had either the AstraZeneca vaccine or the Pfizer vaccine. And when you put those two figures together, that means that in the over 80s, we are preventing 80% of hospital admissions. It's 80% protection against admissions. We have a little bit longer data for the Pfizer vaccine. And again, if you have caught COVID despite being vaccinated and have had a single dose of Pfizer vaccine, what we have shown is that your chance of dying from the infection is reduced by 54%. So really a big additional reduction. And again, if you put that together with the protection that you're getting against infection in the first place, that means that there's almost 85% protection against dying with a single dose of the vaccine. And again, we see better figures after the second dose. On top of that, our data in healthcare workers has shown that healthcare workers who are vaccinated have a 70% reduction in their risk of getting infected after a single dose. And that's whether they are a symptomatic case or an asymptomatic case. And that means they are therefore less likely to spread to vulnerable individuals that they care for. And the really exciting data that came from Scotland last week suggested that those vaccinated healthcare workers have a 30% lower chance of passing infection onto their household contacts, as Secretary of State's already mentioned. So this is really the first evidence we have of a reduction in transmission from vaccinating. And it means that the more people we vaccinate, the more we are going to be able to reduce the spread of infection. So overall, this is really now translating into seeing a decline in deaths and serious cases from this infection. And it means every day we vaccinate more people, we are preventing more deaths. So I think we also know, as I think we've seen the antibody data, we've done a study today again, which shows that 75% of that older group have protection and immunity in their blood. So again, very good results. So overall, we will expect to see, as more people are vaccinated, a bigger impact on cases, on hospitalizations, and on deaths. So I just use this opportunity to encourage anybody who's eligible for vaccine to come forward, to take the vaccine. Both vaccines work incredibly effectively. I myself had AstraZeneca vaccine on Friday, and I'm very pleased that I'm now hopefully as well protected as the people we've been studying. Thank you.
Thank you very much, Dr. Ramsey. Professor Van-Tam.
Thank you, Secretary of State. Good afternoon. I don't mind repeating my thanks on top of everybody else's to the NHS teams who day after day continue with the vaccination programme. It's a real tribute to their perseverance and determination that they do so, and I feel very privileged to occasionally be able to stand alongside them and help out in the vaccine centres. As the Secretary of State has announced, we are now into the last cohort of the Phase 1 programme. It's important we get that done properly before we move on to Phase 2, because Phase 1 is where the patients are who suffer the mortality. And, you know, a bit like a football game where the strikers who score the wonder goals are the ones who make the headlines, actually the hard yards are done by the defenders and by the defensive midfielders tracking back for 90 minutes of the whole game, watching everybody's back. And this is what it's going to be about now, tracking back and making sure that we finish the job properly in the Phase 1 cohorts before we move on. That high uptake is really, really important. I will turn now and spend a few moments addressing what has clearly been a very important and topical media story in the last few days, which is about vaccine safety, and in particular the events in Europe relating to the AstraZeneca vaccine and the stories about blood clots. So where I will begin is that with the European Medicines Agency's spokesperson themselves and their statement, this is the European Medicines Regulator, our equivalent of the MHRA in Europe, there is no indication that vaccination has caused these conditions. We are still firmly convinced that the benefits of the AZ vaccine in preventing COVID-19 outweigh the risks of side effects. And I think that's really important to emphasise that that is the official position of the European regulator, as it is the official position of our regulator, the MHRA. But behind the scenes, there is a lot of work going on to look at whether there is a signal in relation to what we call venous thromboembolic events, clots, VTE for short. And there's a lot of evidence emerging now that is reassuring that there is no overall excess signal or increased risk. And I expect, without prejudice to their absolute findings, those to be the final conclusions of the EMA and the MHRA in due course. So no evidence of increased risk, but as you heard from Professor Ramsey, a lot of evidence that the vaccine is actually saving lives. And that's the really important thing, that we push on with this. And I think from the enthusiasm of the patients I've vaccinated, I see the enthusiasm of the British people to push on with this, because vaccines don't save lives if they're in fridges. They only save lives if they're in arms. And that's a really important fact. All medicines have side effects, and all medicines have benefits. And that's the whole point, that you have to look at both sides and say, how big are the benefits in relation to the risks? So even something really simple like paracetamol, and here's a data sheet from a box of paracetamol. The rare side effects are allergic reactions such as skin rash, mouth sores, fever, difficulty breathing, more prone to bleeding, bruising, fever, infections, nausea, sudden weight loss, loss of appetite, jaundice, yellowing of the eyes and skin. Those are documented rare side effects of paracetamol. But we all understand the benefits of them. And this is no different a situation, that there's no proven association with the blood clots, and we have very clear evidence that these vaccines are beneficial and save lives from what is otherwise, for some people, particularly the ones we are targeting, a potentially lethal disease. I'll stop there, Secretary of State.
Thank you very much, JVT. We'll now go to questions from the public and then questions from the media. The first question is from Lynn from Newcastle.
Will shielding end on March the 31st? I'm lucky enough to have had both my Pfizer vaccinations, and I would like to return to work as a nurse in the NHS. Will this be possible on April the 1st?
Yes, it will, Lynn. I'm delighted to say that shielding will be able to end on the 31st of March. And I'm absolutely delighted that we'll be able to welcome you back into the NHS as a nurse. And we all know how important it is to get more nurses into the NHS, and getting you back will be a very, very important step. So I'm delighted you've had both of your vaccines. I hope you've heard from Dr. Ramsey just how effective they are, and it's great news that we'll be inviting you back. That's fantastic. Thank you very much indeed. Sarah from Wiltshire has sent a question in, and the question is: in the United States, vaccinated people can meet indoors with other vaccinated people, or with others where there is low risk. What are the plans to adopt similar measures in the UK, and at what point will it be deemed to be safe for social distancing among vaccinated adults to be no longer necessary? Well, this is a really, really important question, and the approach we're taking in the UK, Sarah, is that we're going to take the steps together down the roadmap. Because it's not possible to vaccinate everybody at once, we've been taking a clinically advised priority in terms of who gets vaccinated, what's the order of the queue, and then we've said that because that means that we are providing the vaccine to different people at different times, the fair and right thing is to then lift all the measures at once, and as in measures for all people at once, as opposed to differentiate by who has and hasn't had the vaccine. Also because we've got to put in place anyway for things like international travel an ability to show you've had the vaccine, but that isn't there yet. So we've decided to take an approach where the whole country moves in one step at a time. Thank you very much indeed. The next question is from Laura Koonsberg at the BBC. Laura.
Thank you very much, Secretary of State. You've just told everybody that we are on track with the vaccination, but you haven't mentioned this letter from the NHS, which has just come out, which says that there is a significant reduction in the available supply and that vaccine centres should stop taking appointments for the whole month of April. What is going on? And can you explain that shortage in supply? And what do you make of comments from Brussels today from the President of the EU Commission about the UK should be sending vaccines to the European Union?
Thanks very much indeed. Well, as I set out in my remarks, now that we've opened up to the 50 and overs, and then we're going to really focus on getting the vaccine to those who are the most vulnerable. And of course, we have a whole load of second doses that we need to deliver. Vaccine supply is always lumpy, and we regularly send out technical letters to the NHS to explain the ups and downs of the supply over the future weeks, and what you're referring to is a standard one of those letters. But I've set out the details in terms of how we can deliver on the vaccine programme, where we're on track to meet the target of offering to all groups 1 to 9 on the 15th of April. I mean, if you think about it, it's currently the middle of March, and we've already been able to open up to invite all over 50s in, and we need to make sure that we reach just as high a proportion as possible. And you'll see in the letter, it refers to the focus that's needed on the particularly vulnerable groups. So that's what we're going to be doing to protect as many people as possible. Turning to the issue of supply from the European Union, of course, we work with our European colleagues all the time. It's important to set out that the Oxford AstraZeneca vaccine was produced from research that was funded by the UK government, tens of millions of pounds. We set up the supply chain, not just here in the UK, but indeed we helped set up the supply chain in the EU. This vaccine is provided at cost to the whole world, so it's now being manufactured all the way around the world. And we legally signed a contract for delivery of the first 100 million doses here for people in the UK, as you would expect, both to ensure that people in the UK can get their jab and also because this is a UK-funded, UK-delivered vaccine. But we're very happy for others around the world to be able to also manufacture it at cost, but at the same time, as President President von der Leyen has said, she said there should not be restrictions on the export of vaccines by companies where they are fulfilling contractual responsibilities. And so the supply of vaccines from EU production facilities to the UK is indeed fulfilling contractual responsibilities, and we fully expect those contracts to be delivered on. Next question is from Romilly Weeks at ITV.
Health Secretary, Dominic Cummings seems to think that your department is to blame for one of the biggest failings of the pandemic, the supply of PPE, and has nothing to do with one of its biggest successes, the vaccine rollout. Is that how you see it?
Well, the vaccines rollout has been a huge team effort, and it's been an awful lot of people pulling together to make it happen. Obviously, the health department, my department, also the vaccines task force, who've been absolutely brilliant, and the NHS, who have led the way in terms of the delivery. It's been a huge team effort, and one of the striking things about being involved in the vaccine rollout is that the spirit is a positive, mission-driven, can-do spirit that we all share. And I think everybody involved in the vaccine rollout would agree that we have that positive esprit de corps, and that's the best way to leave it. The next question from Catherine Sampson at STV.
Thank you, Health Secretary. With the vaccine rollout underway, I think a number of families are really desperate to find out when they can reunite with loved ones who live in different UK nations. Now, yesterday, the First Minister of Scotland suggested cross-border travel restrictions would ease from around the 26th of April, but she didn't give a firm date. So I'm just wondering, do you have a firm date, and do you think it's important that the whole of the UK moves as one on this? And just on a separate note while I'm here, just wondered what you made of your former cabinet colleague David Davis's statement in the Commons yesterday. Was he right to use parliamentary privilege to do it?
Thanks very much. So on the first question, I very much look forward to all the restrictions on travel within the UK being removed. We've set out when the English restrictions will be removed, and we'll lift the stay at home message as part of the roadmap out. And I've no doubt that within a short few weeks, everybody will be free to travel around the UK, so long as we're able to keep this progress going, both the progress in the UK-wide vaccination effort and keeping the number of cases under control. When it comes to what my colleague David Davis said in the House, he's a very experienced parliamentarian, very long-standing. It is absolutely right and proper to be able to use parliamentary privilege in the way that he did. Parliamentarians should give due consideration before using parliamentary privilege, and I'm sure that he did that. The next question from Jason Groves at the Daily Mail.
Thanks, Health Secretary. You skated over this issue of a fall in vaccine supply like it's some kind of technical issue, but I mean, reading this letter, it feels like a pretty big deal. There are millions of people under 50 who are waiting for their jabs, and it looks like that's going to be delayed. Can you tell the under 50s when they're going to get their jab? Can you also explain to them why people in their 40s who want the jab should have to wait while you try and strong-arm people, older people who don't want it?
So,
and could you also just tell us whether this setback is going to have any impact on the lockdown timetable?
No, as I said, the supply is always lumpy, and we are on course to deliver the offer that everybody who's aged 50 and above will be able to get vaccinated by the 15th of April. I recommit to that today. And of course, these supply schedules have moved up and down throughout this whole rollout. It's absolutely par for the course, and it is that's why it's that is a normal operational letter. But the critical thing in terms of the readers of the Daily Mail is I can assure readers of the Daily Mail that there is enough supply, and we have the NHS across the UK ready to be able to deliver on the offer of a vaccine to all over 50s by the 15th of April. And sorry, what about the under 50s? When are they going to get their jabs? Looks like they're going to have to wait at least an extra month now. No, because we're committed to all adults being able to get the jab by the end of July, and we're on track to deliver on that commitment. So it is, we're making absolutely fantastic progress in the vaccination effort. I'm delighted we're able to open up to millions more people today. And of course, the future forecasts are always lumpy, and sometimes they go up and sometimes they go down. But we've made these public commitments, and I'm absolutely delighted with the team because we're on track to meet them. Thanks very much. And the next question is from Aubrey Allegretti at The Guardian.
Good afternoon, Mr. Hancock. Scientists, doctors, the bereaved, and now Dominic Cummings have urged for a lessons learned public inquiry into the government's handling of coronavirus. Why can't we have one now? Are you concerned that the Department of Health couldn't cope with the pressure of public inquiry at the same time as the pandemic? And to Professor Van-Tam, has every lesson that could have been learned so far been learned? If not, then wouldn't a public inquiry ensure that happens sooner rather than later?
Well, we're learning lessons all the time. I mean, we're learning lessons from the vaccine rollout. You've just heard some of the extra evidence. We constantly look at the actions that we take and work out how we can make sure the response is as good as possible. So that is happening all of the time. Professor Van-Tam.
Yes, thank you for the question. I mean, I think the timing of inquiries is entirely a matter for ministers and politicians. It's not a matter for physicians. Personally, would an inquiry be an unwelcome distraction for me personally at the moment when I'm very focused on the vaccine programme and the vaccine programme we might need in the autumn? Who knows? I think it would be an extra burden that wasn't necessary. Is looking back on what you did and whether you could do things better a function of medicine in terms of the clinical audit that happens in every GP surgery and every NHS trust up and down the land? Yes, it is. Will lessons be learned in due course? I am sure lessons will emerge.
Thanks very much. Final question is from Emily Ashton from Bloomberg. Emily.
Hello, from Matt Hancock, I just wanted to ask you, say that the vaccination targets will still be met. Is there any scope then to bring forward the dates of the roadmap for easing lockdown, or are they absolutely the earliest dates possible? And for Mr. Hancock and Professor Van-Tam, if possible, as more people are vaccinated, data is showing that more and more people are out and about, despite these rules in place. Some older people are meeting people indoors now they've been vaccinated. You see people playing football in the parks at the weekend. What do you say to those people tempted to break restrictions once they've been vaccinated? And is there a risk of a possible third wave, as we're seeing in other European countries like Italy?
Thanks very much. I mean, on the second question, going and playing football with your own family in the parks is absolutely fine, and always has been. So I'm not sure that's a piece of evidence that we should take for people breaking the rules. In fact, I'd say that both what we measure and my experience of being out and about is that people are being unbelievably supportive of the rules and doing their bit. I think that's. I think it's terrific how the British people have risen to this challenge that we've all faced. JVT, I don't know if you've got anything to add.
Yes, thank you. I have two key science points. People should remember that it takes quite a while for antibodies to become measurable in the bloodstream after vaccination. Certainly 14 days. In the younger age groups, almost certainly 21 days or more in the older age groups. But given the data that I've seen, and perhaps Professor Ramsey will comment further on this, that vaccine effectiveness after the first dose continues to increase beyond the 21-day mark, clearly there is something going on about further maturation of the immune response and greater protection. So you're not protected the moment you've had the vaccine. It may be several weeks. And you still then require a second dose before you are optimally protected. Nevertheless, I understand, and you get it in my emails about can I go and see X or Y now I've had the vaccine. Clinically, once properly and fully vaccinated, it is, you are materially safer. But my message to everybody is, look, let's try and get out of where we are through the successful use of vaccines once. Can we just do it properly once? So please hold the line just a little bit longer. And we're only talking a few more months. Just hold the line because it will get better.
Thanks very much. Dr. Ramsey.
Yes, I mean, I think it's not just about yourself, of course, with vaccination. It's about protecting others. And, of course, we want as high a level of protection as possible before we really want people to start behaving more as they used to. So I think our message is quite clear. Once you've had your vaccine, it'll take a while. Please don't change your behaviour. Try and carry on as much as you can, keeping to the rules, keeping the distance, and avoiding unnecessary contact.
Thanks very much indeed.
Mr. Hancock.
Yes.
About the dates for unlocking the roadmap. Are those dates set in stone as the earliest possible dates?
Yes, they're set out in the roadmap. And the reason for those dates is to give 5 weeks between steps so that we can see the effect of each step before making a decision after 4 weeks, with a week to go, as to whether we're able to take the next step. It's a cautious, but we hope irreversible path. And the effectiveness of the vaccine that Dr. Ramsey set out today gives me increased confidence that we're going to be able to walk down that road as set out in the roadmap. And we can see that the vaccines are making people safe and saving lives. And we're on track on the vaccine side. And we've seen the cases coming down. Critically, we're seeing the number of hospitalisations and deaths falling very sharply, and that is good news for us all. Thanks very much indeed.